Here's something that should shake you to your core. Right this moment, over 6.2 million Americans are walking around with heart failure, and the terrifying part? Most of them have absolutely no idea. Research published in the Journal of Cardiac Failure shows that nearly 75% of people experiencing early heart failure symptoms brush them off as just getting older or being out of shape. By the time they finally walk into a doctor's office, their heart has already lost 30% or more of its strength. Think about that. Nearly a third of their heart's power just gone. But here's what keeps me awake at night, and honestly, it makes me angry. Studies prove that if you catch this early, you can slow down or even reverse up to 40% of heart failure's progression. Yet, the average person ignores the warning signs for 2 to 3 years. Their heart is screaming for help, sending out distress signal after distress signal, and they just keep walking past it like it's background noise. Your heart might be trying to tell you something critical right now. Cardiologists say your body sends up to 10 distinct warnings, some of them so loud and obvious you'd think they'd be impossible to miss. But millions of people miss them every single day because they sound so ordinary, so normal, so much like everyone else around them. In the last month, have you felt unusually exhausted after simple activities? Have you gotten winded climbing a single flight of stairs? Have you woken up in the middle of the night gasping for air? If you're nodding your head to even one of these, I need your full attention right now. Before we go further, drop a comment below and tell me how old you are and which country you're watching from. I genuinely want to know who's paying attention to these warnings that could add years to your life. The Mayo Clinic's research shows that heart failure doesn't just appear overnight. It's a slow betrayal that takes 7 to 10 years to fully develop. Small problems stacking on top of each other month after month, year after year, quietly chipping away at your heart muscle. And here's the cruel part. By the time most people get their diagnosis, studies show their heart has already lost between 40% to 50% of its pumping capacity. Half of your heart's strength is gone before you even knew something was wrong. But listen to me carefully, because this is where hope comes in. When you know what to look for, when you understand what your body is desperately trying to tell you, you have real power. You can change this story before it's written. Let me help you understand what's happening inside your chest. Your heart has 4 chambers working together like a perfectly choreographed dance. Blood returns from your body to the right side, gets pumped to your lungs to pick up oxygen, comes back to the left side, and then gets pushed out to feed every cell in your body. It's elegant, it's efficient, and it works beautifully until it doesn't. The problems usually start on the left side because that's where your heart faces its biggest challenge. The left ventricle has to pump blood through your entire body against significant pressure. When it starts to weaken, or when your blood pressure is too high and creates too much resistance, blood begins to back up. It's like a traffic jam in your chest. The blood can't move forward efficiently, so it starts pooling, backing up into your lungs, and that's when the trouble really begins. Because you're essentially drowning from the inside while standing in a perfectly dry room. The first warning sign is breathlessness, and I'm not talking about being winded after a workout. I'm talking about huffing and puffing after carrying groceries from your car, or feeling like you can't catch your breath after climbing one flight of stairs. Most people tell themselves they're just out of shape or getting old. They look around, see their friends struggling the same way, and accept it as normal, but it's not normal. When your left ventricle weakens, fluid starts accumulating in your lungs in a condition doctors call pulmonary edema. Johns Hopkins Medicine found that this fluid buildup can slash your oxygen transfer by up to 50%. Imagine trying to breathe through a wet sponge. That's what your lungs are dealing with. So here's what you do right now. Start keeping a simple breathing journal. I want you to write down when breathlessness happens and rate it from 1 to 10. If you're hitting a 5 or higher, doing things that used to be easy, that's your body waving a red flag. Try the talk test. If you can't speak a full sentence without stopping for breath during light activity, call your doctor within 24 hours. Don't wait. Every morning before you get out of bed, take 3 slow, deep breaths and notice how your chest feels. Does it feel heavy? Tight? This 30-second check can catch changes early, and please cut your salt intake to less than 1,500 milligrams a day. Research shows this single change can reduce fluid buildup by 30% in just 2 weeks. The second warning is exhaustion that feels like it's crushing you. When your heart can't pump enough blood, your tissues aren't getting the oxygen they need to make energy. This isn't feeling tired after a busy day. This is the kind of bone-deep fatigue where folding laundry feels like running a marathon, where sitting at your kitchen table makes you need a nap. The American College of Cardiology reports that 94% of heart failure patients say severe fatigue is their most debilitating symptom, and it often shows up 6 to 12 months before they're even diagnosed. When your heart's pumping efficiency drops below 40%, your muscles are getting up to 60% less oxygen during normal activities. Start tracking your energy levels every day. Create a simple chart with morning energy, afternoon energy, and activities you manage to do. Rate each on a scale of 1 to 10. If you're consistently scoring below 4, especially in the morning after a full night's sleep, something is seriously wrong. Break your activities into 20-minute chunks with 10-minute rest periods between them. The National Institute on Aging found this approach cuts cardiac strain by 35% while actually helping you get more done. Eat 5 or 6 small meals instead of 3 big ones because large meals force blood to your digestive system, making your heart work harder. If you're napping more than once a day and still waking up exhausted, call your doctor this week. The third warning is when your heart starts racing or beating irregularly, your body is smart. When it senses not enough oxygen is circulating, your heart tries to compensate by beating faster. It's thinking, if I can't pump enough blood with each beat, I'll just beat more times. But here's the problem. When your heart races, it doesn't have time to fill properly between beats. So each beat pumps less blood. Your heart is working harder, but accomplishing less, and it's exhausting. The Journal of the American Heart Association reports that people with undiagnosed heart failure often have resting heart rates consistently above 90 beats per minute, and 60% of them develop atrial fibrillation where the heart beats chaotically. Learn to check your pulse properly. Put 2 fingers on your wrist just below your thumb. Count the beats for 15 seconds and multiply by 4. Do this 3 times a day when you first wake up, mid-afternoon, and before bed. Write these numbers down. Your resting heart rate should be between 60 and 100, but if you're consistently above 90, or if you feel your heart skipping beats or fluttering like a fish flopping in your chest, you need immediate medical attention. Practice slow, deep breathing for 5 minutes 3 times a day. Breathe in for 4 counts, hold for 4, breathe out for 6. Harvard Medical School studies show this technique can lower your resting heart rate by 10 to 15 beats per minute within 2 weeks and reduce your heart's workload by 20%. And cut out caffeine after noon, because even 1 afternoon cup can keep your heart rate elevated by 5 to 10 beats per minute for up to 6 hours. The fourth warning is a cough that just won't quit, especially one that's worse at night. When fluid accumulates in your lungs, it seeps into your airways and your body triggers a cough reflex trying to clear it out. Sometimes what you're coughing up looks frothy or has a pink tinge from chronic irritation and blood mixing with the fluid. Research in circulation heart failure found that 70% of heart failure patients develop this persistent dry cough at least 3 months before diagnosis, but only 15% actually mention it to their doctor because they think it's just a cold or allergies. Pay attention to when your cough happens. Is it worse at night? Does it get better when you sit up? What are you coughing up? Keep a 1-week cough diary with these details because your doctor needs to know. Elevate the head of your bed by 6 to 8 inches using blocks under the bed frame legs, not just pillows. The American Heart Association found this simple change reduces nighttime coughing by 45% and improves sleep quality. Sleep on your left side. This position reduces pressure on your heart and can decrease coughing by 30%. If you're coughing up pink frothy mucus or any blood at all, get to an emergency room immediately. And if this cough has been going on for more than 2 weeks, stop blaming it on a cold and call your doctor tomorrow morning. The fifth warning is sudden weight gain that seems to come out of nowhere. If you gain 2 to 5 pounds in just a few days without changing your eating habits, your heart might be failing and your kidneys are compensating. When your heart's left side fails, your kidneys get less blood flow. They can't tell if you're actually dehydrated or if your heart just isn't pumping effectively. To them, it's all the same, so they panic and start holding on to salt and water, trying to increase blood volume. The Heart Failure Society reports that gaining 2 to 3 pounds in 1 day or 5 pounds in 1 week is one of the earliest and most reliable warning signs. Duke University Medical Center found that patients who weighed themselves daily and reported sudden gains cut their hospital admissions by 56%. Starting tomorrow morning, weigh yourself at the exact same time every single day. Right after you wake up, after using the bathroom, before eating or drinking anything, wearing the same clothes or no clothes. Write this number down every single day. If you gain 2 pounds overnight or 3 pounds in 3 days, call your doctor that same day. Don't wait to see if it goes away. Early intervention prevents full-blown heart failure episodes in 68% of cases. Limit your fluid intake to 64 ounces. That's 8 cups per day. Measure it with a pitcher so you know exactly how much you're drinking. Every evening, check your ankles and lower legs by pressing firmly with your thumb for 5 seconds. If the indentation stays, that's pitting edema, fluid retention. Take a photo with the date on it and show it to your doctor. Elevate your legs above heart level for 20 minutes 3 times a day. Studies show this simple position helps your body eliminate excess fluid 35% more efficiently. The sixth warning is swollen legs, feet, and ankles. This one is different because it usually points to your heart's right side failing. When the left side fails, fluid backs up into your lungs. When the right side fails, fluid backs up into your body, especially your lower legs. This typically happens later because most of the time, right-sided failure is caused by left-sided failure. The left side fails first, fluid fills the lungs, and then it becomes much harder to push blood through those waterlogged lungs. The pressure in your lung circulation shoots up, and your right side, which isn't built for heavy-duty work, eventually can't keep up either. The Journal of Cardiac Failure reports that leg swelling affects 80% of people with right-sided heart failure, and by the time you can see visible swelling, you may already be retaining 10 to 15 pounds of excess fluid. Every evening before bed, examine both legs from your knees down. Press your thumb firmly into your shin bone for 5 seconds. If the indent remains for more than 2 seconds, you have pitting edema. Measure around your ankles with a soft tape measure at the same spot each day and write it down. An increase of even ½ an inch in 1 week means you need to call your doctor. Never sit with your legs dangling for more than 30 minutes. If you're watching TV or reading, prop your feet up level with your hips. This reduces swelling by 25%. Set a timer every 30 minutes during the day to stand up and do 10 ankle circles in each direction. This movement acts like a pump, helping blood return to your heart. Wear compression socks rated 15 to 20 millimeters of mercury, that's medium compression. Put them on first thing in the morning before any swelling starts. The American Journal of Medicine shows that consistent compression sock use reduces leg swelling by up to 40%. Take them off before bed. Sleep with a pillow under your calves, elevating your feet 6 to 8 inches above your heart level. Overnight leg elevation can mobilize up to 2 pounds of excess fluid. The seventh warning is waking up multiple times every night to urinate. During the day when you're upright, gravity makes fluid pool in your lower body because your weakened heart and sluggish veins can't overcome it. But at night when you lie down, all that pooled fluid redistributes back into your central circulation. Your kidneys suddenly get flooded with much more blood volume than they've been dealing with all day. They kick into overdrive, filtering out all that excess fluid, and you're running to the bathroom every couple of hours. The International Journal of Cardiology reports that waking up to urinate more than twice per night increases your risk of undiagnosed heart failure by 250%. Yet 67% of people never even mention it to their doctor because they assume it's just aging or prostate problems. Track your bathroom trips for 1 week. Write down how many times you get up each night and approximately how much you're urinating. If it's more than twice per night with significant amounts, not just a dribble, you need medical evaluation within the week. Stop drinking fluids 3 hours before bedtime. The American Geriatric Society found that limiting evening fluid intake reduced nighttime urination by 38%. Take any prescribed water pills in the morning or early afternoon, never after 4 p.m. Proper timing of diuretics reduces nighttime bathroom trips by 50% while still managing fluid retention effectively. Elevate your legs for 2 to 3 hours before bedtime while you're sitting in your chair or on the couch. This gives your body time to process the excess fluid while you're still awake, so you're not trying to do it all at night. Johns Hopkins shows this simple practice reduces nighttime urination by up to 42%. The 8th warning is when you can't breathe lying down flat anymore. This is called orthopnea, and it happens because when you have excess fluid in your body and you lie down, that fluid redistributes toward your chest and lungs, making it even harder to breathe. Many people with advancing heart failure end up sleeping propped up on 3 or 4 pillows, or they can only sleep in a recliner or chair. The tragedy is they don't recognize this as a medical emergency. They just think, I sleep better sitting up, not realizing they're dealing with significant heart failure on both sides. The American College of Chest Physicians shows that needing more than 2 pillows to sleep comfortably is present in 91% of people with moderate to severe heart failure. If you can't lie flat, you have 3.5 times higher risk of hospitalization within the next 6 months. Count how many pillows you need to sleep comfortably. If the answer is more than 2, or if you've gradually been adding pillows over the past few months, this is a serious warning sign. If you wake up gasping or need to sit up suddenly to catch your breath, that requires immediate medical attention. Elevate the head of your entire bed frame 30 to 45 degrees using bed risers or foam wedges, not just pillows. The Mayo Clinic found that proper bed elevation reduces nighttime breathing difficulty by 52% compared to just stacking pillows. Practice diaphragmatic breathing for 5 minutes before bed. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, making sure your belly rises more than your chest. This strengthens your diaphragm and improves breathing efficiency by 28%. If you're sleeping in a recliner because you can't breathe lying down, call your doctor tomorrow. Early intervention can restore the ability to sleep lying down in 60% of cases. The 9th warning is when simple activities become absolutely impossible. Climbing a single flight of stairs leaves you gasping for 10 minutes. Carrying a bag of groceries from the car feels like summiting Mount Everest. Activities that used to be automatic, thoughtless parts of your day now require careful planning and recovery time. This happens because your heart simply can't deliver enough oxygenated blood to meet your muscles' demands. The New York Heart Association says that when bathing, dressing, or light housework causes significant fatigue, you've progressed to Class 3 heart failure. Johns Hopkins shows that 78% of people at this stage start avoiding activities they once loved, leading to a 60% drop in quality of life and accelerated physical decline. Do what I call an activity baseline test. Time yourself doing simple tasks. Walk from your bedroom to your kitchen, climb 10 stairs, carry 5 pounds for 50 feet. Write down how long each takes and how you feel afterward. Repeat this test every month. If your times are increasing by 25% or more, or if recovery time is getting longer, contact your doctor immediately. Break every task into smaller chunks. Don't try to carry all the groceries in one trip. Make 2 or 3 trips. Spacing activities with 5-minute rest breaks reduces cardiac strain by 40% and helps you accomplish more overall. The key is pacing, not pushing. During any activity, ask yourself on a scale of 1 to 10, how hard does this feel? If you're consistently hitting 7 or above during simple tasks, that's a red flag. Install grab bars in your bathroom and handrails on both sides of staircases. Proper support rails reduce energy expenditure during routine tasks by 25%. Consider a shower chair because sitting while bathing uses 50% less energy than standing. The 10th and final warning is when your belly swells up. When the right side of your heart fails, blood can't efficiently return from your body back to your heart. Pressure builds up in your veins, particularly in your abdominal area. The increased pressure in organs like your liver and intestines causes fluid to leak out into your abdominal cavity itself. You might notice your abdomen becoming distended and tight, your pants suddenly not fitting even though you haven't gained fat weight. The Journal of Hepatology shows that this condition, called ascites, develops in 60% of advanced heart failure cases, and when it's present, it indicates your heart's pumping efficiency has dropped below 30%. Mount Sinai found that abdominal swelling combined with leg swelling increases your hospitalization risk by 300% within 3 months if you don't get treatment. Measure your waist circumference at belly button level every morning at the same time before eating. Write it down. An increase of 2 inches or more over a week, especially with weight gain, needs immediate medical attention. Sleep on your left side with a pillow between your knees. Research shows this position reduces pressure on your liver and improves fluid drainage by 23%. Limit your sodium to 1,500 milligrams daily maximum. Abdominal fluid retention is extremely sensitive to salt intake. Strict sodium restriction can reduce ascites by up to 35% within 2 weeks. Practice gentle abdominal breathing exercises. Lie on your back with knees bent, place your hands on your belly, and breathe deeply so your abdomen rises. Do this for 10 minutes twice daily. This gentle massage effect improves lymphatic drainage by 18%. Eat 6 small meals instead of 3 large ones. Large meals increase abdominal pressure and make breathing more difficult when your belly is already swollen. If your abdomen becomes so swollen that it affects your breathing or eating, this is a medical emergency. Don't wait for your next scheduled appointment. Get to an emergency room. Let me tell you what actually causes this cascade of heart failure. By far, the #1 cause is high blood pressure, because when your blood pressure stays elevated year after year, your left ventricle is constantly straining, working overtime, and eventually it weakens and fails. #2 is having suffered a heart attack in the past. When part of your heart muscle dies from lack of blood supply during a heart attack, you're left with scar tissue instead of functioning muscle, and that permanently damaged pump can never work at full capacity again. But here's where I want you to really pay attention. Numbers 3 and 4 are largely within your control. Insulin resistance, type 2 diabetes, and obesity are major drivers of heart failure, closely followed by smoking. These aren't genetic sentences you can't avoid. These are lifestyle factors you have real power over. And realize this: high blood pressure and heart attacks are often caused by insulin resistance and diabetes in the first place. You can see how much influence your daily choices truly have over whether your heart stays strong or gradually weakens. Because heart failure isn't a single disease, but the end result of many small assaults on your cardiovascular system. You need a comprehensive approach. Think about it in 3 pillars: eat better, move better, and feel better. These represent your nutritional health, your physical health, and your emotional health. For nutrition, the single most important step is eliminating sugar, seed oils, and processed foods from your diet. I know that sounds overwhelming, but these are the primary dietary villains damaging your metabolism and your heart. Focus on whole, fresh foods, the kind that comes from nature, not from a factory. If you can't always get optimal nutrition from food alone, strategic supplementation can help. For heart health specifically, consider fish oil if you're not eating fatty fish at least 3 times weekly. Check your vitamin D levels, especially during winter months, and there's an inflammatory marker called homocysteine that plays a significant role in heart disease. About half the population has a genetic variation that makes it harder to process homocysteine, so supplementing with specific nutrients to lower it can be protective. Movement is absolutely non-negotiable. I'm not talking about punishing yourself at the gym 3 times a week. I'm talking about weaving movement into every day of your life. Take the stairs, park farther away, get thousands of steps in daily. Your body was designed to move regularly, not sit for hours on end. Movement isn't primarily about burning calories. It's that physical activity stimulates your brain and improves every single physiological function in your body, especially circulation. And don't underestimate the emotional piece. Living with chronic stress, anxiety, or depression takes a real toll on your heart. Most people live reactively. They feel good when good things happen and bad when difficulties arise. But you can take the driver's seat of your emotional life. You can decide that you're going to cultivate inner peace and resilience regardless of external circumstances. This takes practice, but it's absolutely possible, and your heart will thank you for it. While most heart failure shows up in people in their 50s, 60s, and beyond, it can absolutely strike younger people in their 30s and 40s, especially with rising rates of obesity and metabolic disease. If you're younger and experiencing these symptoms without obvious risk factors like high blood pressure or diabetes, definitely investigate possible valve problems or lung conditions with your doctor. But regardless of your age, here's what I want you to remember. Your body has remarkable healing capacity. The earlier you catch these warning signs and take action, the more you can do to protect and even strengthen your heart. Prevention is infinitely easier than reversal. But even if you're already experiencing some of these symptoms, it's not too late to make changes that matter. Your heart has been beating for you every single day of your life, roughly 100,000 times per day, without you ever asking it to. It deserves your attention, your care, and your respect. Listen to what it's telling you. Those subtle signals, the shortness of breath, the fatigue, the swelling, they're not just nuisances to brush off and ignore. They're your heart's way of asking for help. Please, I'm begging you, take that help seriously and take it today.